Hi everyone, it's Luann here from Happy Without Histamine, and today I'm talking about Mast Cell Activation Syndrome, otherwise known as Mast Cell Activation Disease or Disorder as well. So I usually shorten it to MCAS or MCAD. Now, Mast Cell Activation Syndrome is a constellation of symptoms, and it is usually across multiple systems in our body. Mast cells are active in our digestive system, our lungs, our other organs, our bladder, and also throughout our body. And we can see symptoms in any of our body systems. So the most common ones that we see are often also overlap with histamine intolerance. And they also overlap with a lot of other conditions. So headaches, migraines are one, anxiety, depression, irritability, panic attacks. We've got brain fog, which is quite common, sleep disturbances and sleep apnea. We've got everything gut related, so IBS, heartburn, reflux, diarrhea, constipation, inflammation in the esophagus, gastritis. We've got inflammation in the rest of the bowel and small intestine as well. Nausea, pain. You can also have discomfort in the mouth as well, so inflamed and painful mouth, gums, inflamed lips, tongue, swollen tongue, and dry mouth as well. You can get flushing, so a lot of times we see the bright red flushing in the face and the ears, neck. We also see hives and itching on the skin, which can be anywhere, as well as rashes. Dermatographia is one that is often considered to be quite telling, which is where you can scratch a line in the skin with your nail and it will actually leave a mark, a red mark. The other ones are wheezing, shortness of breath, or asthma. There are a lot of mast cells in the respiratory system. You also get nasal congestion, postnasal drip, lots of excess mucus and inflammation throughout the sinuses, vertigo, anaphylaxis, which is a really telling one. And the main difference between mast cell based anaphylaxis and the instant IgE allergy anaphylaxis is usually time frame. It is a slow burn type of anaphylaxis more commonly. If you have anaphylaxis, please make sure that you're talking to a medical professional and get EpiPens to look after yourself and see the ER if you are suffering. Another one that's really common is poor temperature control. So temperature intolerance to heat and cold, temperature fluctuations. Hypertonia, low muscle tone is another one. Imbalance with circadian rhythms, so staying up all night, sleeping all day, things like that. You're not in sync with the sunrise and sunset. Dysmenorrhea, painful periods, bad PMS, heart palpitations, arrhythmia, and other sensations of being able to feel the heart, high and low blood pressure, food sensitivities, chemical sensitivities, fatigue, malaise, which basically just means feeling terrible, pain and nerve sensitivity, and that can be anywhere in the body. There are mast cells actually close to our nerves in pretty much every area of our body. Easy bruising is another one. Interstitial cystitis and pain, dry eyes and irritation, and also you can get allergic fluid from the eye as well. So irritated fluid. Sensitivity to light, sound, to the sun, to heat, to cold, to wind, to smells, and unexplained weight loss or weight gain. So it's possible to have histamine intolerance and mast cell activation. It's also possible to have mast cell activation in relation to a lot of other illnesses. So it's linked to and is considered potentially to be a trigger of some of the symptoms in ME/CFS, fibromyalgia, Ehlers-Danlos syndrome, EDS, multiple chemical sensitivity, MCS, POTS, postural orthostatic tachycardia syndrome, obesity, in your IgE allergies, which actually can be triggering your mast cells, diabetes mellitus or diabetes type 2, and other chronic illnesses. So, how do you know if you have mast cell activation syndrome? Well, there are multiple viewpoints and frameworks for diagnosis, and mast cell activation syndrome as a constellation, as this syndrome, was only officially recognised in 2007, so it wasn't that long ago. Since the last 10 to 20 years, there have been multiple research papers, there have been multiple frameworks for diagnosis put forward, and there's still not a really good consensus among the medical community. So the key points that they seem to have agreement around are clinical history of symptoms, if anaphylaxis is present, hives, flushing, itching skin, headache, abdominal pain, diarrhea, respiratory symptoms, and hypotension, which is the low blood pressure or slow heartbeats. Absence of other known disorders. So a lot of this is actually done by an absence of other things that they've found that they can say, no, it's this. So they're working on exclusion a lot of the time. And there's one test that seems to have some consensus, which is a serum tryptase level. But it's not as simple as just taking a serum tryptase. It's actually about taking a serum tryptase baseline, which is when you're feeling well, and then taking another one when you're not feeling well, and it has to have an increase of at least 20% or more above that baseline level. Tryptase testing can be very tricky. It's very hard to get that test at a time when you are actually that unwell. And also, a lot of people don't even show any tryptase and yet are showing all of the symptoms. So the general agreement seems to be that testing for the other mast cell mediators, such as histamine, is not conclusive for MCAS. So if you've got high histamine levels in your blood, it does not mean you have mast cell activation syndrome. The serum tryptase levels are more reflective of your overall body load of your mast cells. But as I said, a lot of patients have normal tryptase levels, and yet they still have these symptoms. So it really does depend on what your doctor's view is of the research and how they treat. A lot of doctors will still continue to treat with the suspicion of mast cell activation syndrome, even when serum tryptase levels are not showing, because they'll treat based on symptoms. Regardless of your status diagnostically, you can do so much with complementary medicines. So from my point of view, as a nutritionist and working with both nutrition, neuroscience, and gut restoration, we can improve all of these symptoms that we've talked about that are related to mast cell activation in a very, very gentle way. The big thing about mast cells is we have to do things slowly and carefully. Now, a lot of people also may have some mast cell activation along with their histamine intolerance, but they don't fully have mast cell activation syndrome. I see this a lot when I see people who have histamine intolerance, but now are starting to also have problems with oxalates, salicylates, lectins, lots of other foods, lots of other smells, heat, sound, things like that. They may not have got to the point where they're considered to have the mast cell activation syndrome diagnosis, but they are having mast cell activation, often significantly in the gut and other organs. So if you're having issues with mast cell activation syndrome, or you think you might have histamine intolerance or mast cell activation in some form or another, you can book in a discovery call with me and we can work together. I have packages where I work holistically with the person and we look at every area of your body using your brain, your gut, nutrition to work on all of these mast cell activation symptoms and get down to the root cause and heal from the bottom up. Thanks, and I'll see you again next time.